Yo, big nuns.
Yeah, I feel like.
Alright, cool. Yo, introduce yourself, like.
My name is Fortune Oko. I am a first year physician associate student in a certain university. And introduce yourself, Amo.
Hello, my name is Nana Adoma. I am a second year film and TV student, studying at an undisclosed university. Yeah.
Well, why can't you disclose it still?
See me, I like my privacy.
Yeah, I hear you still.
Some people, they don't need to know all the information about you, so.
Wallahi, I swear. So, fam, tell me, what did you have for breakfast this morning, fam?
What do you mean? Fam, did I even eat breakfast? Fam, have I even eaten today? That is, oh my days. Oh, I just realized. Crazy. What did you eat, man?
Fam, I didn't eat anything. You know, I've got IBS in it, so man, I said, obviously we're dapping up still.
See, they won't know that we're big people as well, you know. They must think we're skinny.
That is crazy. So, fam, what are we gonna talk about today then? Hold on.
What was it today? We talk about stress.
Stress. Stress.
So you're obviously what, a master's student now.
Well, you know
Yeah,
how powerful this is.
How is stress treated?
This
old stuff.
This is
don't interrupt them, Carly. You came in like Superman, but they're recording.
Well, we started time ago.
They started time ago. So either join them or we leave them.
I was saying. What are you man talking about?
Stressing it.
Yeah, G.
Come in. Where the rest of
I'm
the
still.
people?
No, we have to close it off now. Not everybody can get in. I know you're excited, so either go in or you come out.
So, fam, stress, man, stress. You said I'm a master's student. Obviously, you know what? You go into masters thinking that life's not going to be too stressful, seeing that it's like, obviously, teachers aren't around you. The teachers aren't around you, innit? Like,
yeah.
You don't have teachers always look like undergrad, college, high school. At high school, you have teachers on your case all the time. College, less teachers.
Yeah.
Undergrad, teachers don't even care, brother. And then you think of masters, nobody cares. Because it's PA, physician's associate, teachers are like behind you all the time, always checking up on you. Obviously, it's not a big thing, there's more work to do. But like I say, if you keep on top of your work, you'll be fine, innit? But like doing placement, being in 4 times a week, and one of those days, the one day that's off, which is Wednesday, is placement. Sometimes it gets too much from it. It just gets too much.
Even doing placement in like a hospital, even.
Hospitals
itself should be straight. Like,
see, I'm doing mine in a GP right now, and GP placement is nice, man. I'm not gonna lie, it's like nice, it's calming, support with doctors, support with PAs, support with AMPs, nurse practitioners, nurses. You get me, and then support with staff. It's nice in a GP. Hospital though, like. As from other students that I've spoken to, hospital can be some of the worst times in your life. But the thing is, it's one of them where it can be the worst time. It's stressful. The journey is stressful, you get me? Like getting there, getting to the hospital is stressful. But then if you're actually in there, some people have told me that apparently you can literally go a whole day without anyone noticing you because it's that busy. So you have to push the notion forward that you want to learn or you want to get involved, so you have to ask someone, or can I do this, can I do that? But apart from that, nothing's really crazy.
what? Okay, even because you used to, like, I know you used to work in hospital as well during like summer as well.
Yeah.
So like, comparing the caliber of patients, like, how is it more stressful or less stressful dealing with somebody?
See, yeah. So I worked as a HCA in it, and I'd say being a PA or a actual medical professional than a carer is more stressful, because as a carer, I only really had to like clean a patient, make sure, turn them every like 2 hours, depending on like if precious or if they're like mobile or self-caring. But then being like a medical professional, like a nurse, right? Let me use nurses for example. Nurses have to make sure they're given all the medications on time, have to make sure if the medication has been calculated, they'll have to make sure that they calculate and give the right medication. Then potentially they'll have to help HCA do turns and do self-caring and bum checks and etc. Then they have to do the observations, which is like your temperature, your pulse, your heart rate. You feel me, fam? So nurses have a lot more to do. For PAs, I feel like we have quite a bit to do, but not as much compared to nurses. So shout out all my nurses out there, man. Especially the nurses in Liverpool, man. Come on.
Oh, man. You know what? I wasn't even expecting. I thought you would say it would be harder to be, or like more stressful being a PA.
Fam, you know what? I feel like the stress only comes out when it's like when you have to, if you have a really like complex case. You have a really complex case. Apart from that, there's nothing really big to the whole situation. I can't lie.
Sorry to interject.